This UCSD TV program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest programs.
Hi everybody, I'm Dr. David Granet, and welcome to Health Matters. Driving here, I heard a radio ad for something that we're going to talk about right now, so it was really timely. It is estimated that 1 in 10 people between 40 and 50 have this problem. 1 in 5 in their 60s have this problem, and maybe 1 in 4 in their 70s have this problem. Did I get your attention? I'm talking about the problem of low testosterone. To get us through this, we have with us an expert, Mike Hsieh. Welcome.
Thank you.
Dr. Hsieh is assistant professor in the Department of Surgery here at the University of California, San Diego, where he's also director of the Men's Health Center. I'm so glad that you're here to talk about this, and I wasn't kidding. On the way here, I'm listening to the sports radio station, and they have an ad for low T. And so I'm looking forward to talking to you about it. By the way, the numbers they quoted were somewhat different than the numbers that we may talk about. But I want to set the stage because I did mention that you were director of the Men's Health Center. Why do men need a health center?
Well, that's a very good question. Men's health is a very exciting and evolving field. There's a very well-established women's health movement. Women's health initiatives revolve around breast cancer, contraception, sexually transmitted diseases, but men seems to be kind of ignored for a long time. As you know, we're dealing with an aging population, so men and women both are living longer, so men starting to seek help a little bit in terms of, how to age well, how to age better, and therefore there is a demand from the general population that, we know how to take care of women, we should focus on how to take care of men as well. And a lot of it started with actually men's sexual health, because a lot of times guys are very embarrassed talking about their decreased sex drive, their erection problems. So, and for the sexual health professionals, you don't want to put a sign up on the door and say this is men's sexual health that pretty much drive every man out of the way. So we take out the sexual part, we call it men's health. And that's kind of where the starting of men's health is. We start focusing on men's sexual health. And then it's starting to grow because obviously as men age, there's other health problems such as joint issues, musculoskeletal issues, cardiovascular issues. So now men's health has grown, and we also found out a linkage between hormone imbalances such as testosterone and to other metabolic problems that men might suffer. So therefore, men's health my vision of a men's health center is really a multidisciplinary approach to help the aging population age better, because they're going to live longer, and we should figure out a way to take care of them better as well.
And an additional throw-in is your background as a urologist is reproductive capabilities and infertility,
yep,
as well as that goes along with it. So we both mentioned the word testosterone, and we're going to talk about what it does and what happens as it changes. What is it? What is testosterone? So
testosterone is just one of the numerous hormones in the man and woman's body. Women actually have testosterone in their body as well. Testosterone is very important because it's one of the most important sex hormones in a man's body. In utero, it's important for men's development of their physical characteristics. During puberty, it's important for them to start making sperm. It's important for them to gain muscle strength and to hit that puberty. And then as the man age, the testosterone also, it's important for their cognition, for their bone health, for their sexual function as well.
So it's a powerful driver.
Yep.
Chemically, what is it?
chemical, it's a steroid hormone. So that means people might hear words like, athletes abuse steroids and that kind of stuff. So it is considered a steroid hormone, meaning that it contains property where it acts inside a cell in the man's body instead of outside of a cell. So, but it acts from head to toe. It's responsible for even hair loss, male pattern balding, and all the way down to stem cell productions and red blood cell production.
So we're supposed to have testosterone.
Yes.
And we're supposed to have a certain amount at certain times in our life.
Yep.
Do we know how that changes over time?
Yes, we actually do know how it changes over time. As I mentioned earlier, in utero, there is a surge of testosterone for the fetal development, for the baby to grow up, when they're born, to be a boy. So there is a surge which is mediated through the mom's hormone, specifically HCG. During puberty, there's also another surge of testosterone for men to start developing their secondary sexual characteristics, deepening their voice, increased muscle strength.
How long does that last? So, I mean, if we have a surge, is it a surge for a week and then it kicks off all these changes, or does it go up and stay up for a long time?
It goes up and actually stay up for a couple of years until puberty finishes. So there is a surge at that time as well. But then for the most part, during a man's, the end of puberty, that surge, actually, that level stays pretty steady throughout most of the guys during their 20s and 30s. And then as a man age, just like woman's hormone goes down with aging, a man's hormone also goes down with aging. So we call them andropause. And that's one of the words you might hear on commercials and that kind of stuff. As the testosterone is going to go down, it's the menopause for women. We call them andropause for men.
The other word I heard was menopause instead of menopause.
Exactly.
So, yeah. And so that change takes place. Is that responsible for aging? Is it a consequence of aging? Is it a problem, or is it normal?
Yeah, well, it's definitely a normal physiologic response for a man's testosterone level to go down with aging. Back in the day, before we recognized this phenomenon, we just assumed that, okay, well, when you become middle-aged, 50s, 60s, it's normal for you to get more tired. It's normal for you to can't keep your eyes open through the shows after dinner. Normal to gain some weight. It's normal to have issues relating to erections and sex drive, but that we just associate that with just part of aging. That's what my grandfather looked like, so that's what I'm going to look like when I'm 60 and 70. I'm not going to be as active. We now know that a lot of that can contribute to low testosterone. Testosterone, just like any hormone imbalance, if you have diabetes or thyroid problems, your body's not healthy when you're running a deficit in certain hormones. By restoring the balance, your body functions better. So it's true that for the guys and this is very true for men who are overweight. They try all types of diet programs. They eat salad till the cows come home. They exercise with a trainer, and then they don't get any results, and then they ended up very discouraged and gave up on their lifestyle changes. And in part of these groups of men, part of the problem is a hormone deficiency, because if you have an imbalanced hormone, it's harder for them to lose weight. It's harder for them to get motivated and get the energy they need to go work out. So, and studies have shown that by restoring their balance in combination with the lifestyle changes, there are positive body composition changes associated with it. So I think men, we're demanding a little more these days just because we're 60. We don't want to feel like 60, so, and by no means is testosterone a way of anti-aging to make a 60-year-old man 20-year-old again. But if you can give them maybe 5 years or 10 years and get them body back a little bit more, stay active a little longer, and I think that's something that's very positive for the patients.
So if we're looking at the biology of this, as you age, you make less testosterone, which gives you the symptoms of aging.
Yeah.
So by giving you testosterone back, you can help you can't turn the clock back, 60 doesn't go to 20, but you turn back some of the symptoms that we dealt with. Are there health benefits? I mean, you feel more energy, you can lose weight, but other than the combination with obesity, are there other benefits from a health standpoint of normalizing, and we have to talk about what that means, testosterone?
Yes, so actually one of the best research was actually done here on campus at UCSD. We had a population-based study, the Rancho Bernardo cohort, where they studied men in our area. They followed them for a long time, and what they found was that men who live with a hormone deficiency or low T ended up, number one, they don't live as long. They're more likely to have diabetes associated with weight issues. They're more likely to have elevated inflammatory markers such as CRP and things like that in their body. And they're more likely to have cardiovascular problems. So we do know that a guy who has a hormone imbalance doesn't live as long or not as healthy as the men who have a hormone that's imbalanced.
Do we know that replacing that changes the course?
That's a good question. There are studies looking at replacing testosterone, and it is able to reverse a lot of metabolic problems such as cardiovascular, diabetes, weight issues. And there hasn't been a study looking at making people live longer in a survival standpoint, but in terms of reversing some of the metabolic problems, and there has been study that's shown that.
Okay, so now we have to get to it. I quoted some numbers about how many people have low testosterone at different ages. And I told you the numbers that I saw in the science were different than the numbers I heard on an advertisement today. How many people, I mean, what are we looking at that it's the expectation of men as they age who have testosterone that's lower than it ought to be and affecting them?
Yeah, well, that's a very good question. And I don't think we really have the right answer for it, because if I send you to the lab at UCSD, and then they will tell me that our lab tells us normal testosterone is between 300 to 800. Why is it so wide? Because we have no idea. And that's really the honest truth. I can take two men. One guy is both are 70 years old. One guy with a testosterone of 200 is running a marathon. Doesn't feel any different. Another man, 70-year-old guy, testosterone is also 200. He feels tired, he's fatigued, he has depressed mood, he has decreased sexual activities. So what's so different about these guys? It turns out that testosterone is the same in every man and woman's body. If I draw blood from every person in the studio right now, chemically the testosterone is the same. But all the hormones have to act on a receptor for it to work. The receptor that we're all born with are actually very, very different. So when I was doing my fellowship training in Houston, we did some work on sequencing people's genes on testosterone receptors. And what we found that the receptors are different in terms of their sensitivity. Guys with less sensitive receptors are more likely to have fertility problems, symptoms associated with testosterone, because they need more testosterone for their body to work. The guys with more sensitive receptors, they don't need as much testosterone.
This is truly personalized or precision medicine.
Exactly. So this is really a case of personalized medicine where, so instead of adjusting for people's age on testosterone, we probably ought to adjust people's testosterone level based on how much their body needs it, based on the receptor. Unfortunately, the technology is not there right now for us to sequence every man's testosterone receptor gene.
So then what happens? I mean, I heard the ad. They said, come in, get your blood tested. We'll do it for you for free. And how can you, from a blood test then, if you're in that range, I mean, obviously if you're zero, then that tells you something. But if you're in that range, the blood test, it seems like, is not enough, that you need an expert physician to be able to interpret that information in the context of your overall health.
Exactly, and I think this is very important because many of the audiences and us ourselves see a lot of commercial advertisements on anti-aging clinics, low T clinics, men's health clinics. So it's almost like we are in the West Coast, but it is the Wild West out here, and this is nationally. I think the Endocrine Society, which is the only American medical society that actually has guidelines on testosterone, they usually start evaluating a man with low T starts with a physical exam and evaluation of their symptoms. And unfortunately, a lot of these symptoms are very nonspecific. Every time when I give a talk on low T, I put the symptoms of fatigue, depressed mood, irritable, decreased sexual activities. Even a woman in the audience think they have low T, because that could be part of just a busy life, raising young families, or busy life these days. So we really have to combine a clinical symptom with a biochemical testing to try to sort out if what we're feeling is really related to testosterone. And a lot of times it's still even not clear at that level. So my approach has always been to evaluate a patient, make sure they don't have any things that put them at risk of receiving testosterone. Then we start a trial period. I tell them that you might have a hormone deficiency. How you feel might be related to one of the hormones. I don't know how much this is going to help you. So we're going to run almost like a test on you. But we're going to replace your testosterone for 1 month.
And you're going to monitor them.
Exactly. And at the end of the month, we regroup. We repeat their blood work. Let's see if your numbers get better and see if you feel any different. If you feel better and your numbers are better, then maybe we're onto something. If you don't feel better and your numbers are, also kind of mixed, then maybe this is not the answer for you. That's why a lot of people, you should not walk into these anti-aging clinics and make a long-term commitment with them and say, well, this is my problem. I'm going to be for the rest of my life. I'm coming in here, $200. I'm going to give you a shot in my butt. That's
and you're
not
keep doing it forever.
Exactly.
And we know that there's some people that are going to feel better because they're getting a treatment, the placebo effect. And so you're looking for the signs of that as well. Do you have to get a medicine to change your testosterone levels? Are there over-the-counter or other non-medical ways to affect your testosterone?
Yeah, that's a very common question that I get asked almost by every person, even my own family members. There are a lot of over-the-counter supplements, vitamins that promise you to boost your manhood, boost everything. Unfortunately, the supplement side of thing is very mixed. And I will address some of the side effects of receiving exogenous hormones later on. But from a lifestyle standpoint, we do know that the testosterone gets broken down into estrogen in a man's body, in the fatty tissues of our body. So by losing weight or decrease your percent body fat, you don't make more testosterone, but the testosterone you have can stay in your body longer.
So maybe more effective.
Exactly. So that's one way of boosting your hormones naturally. Unfortunately, weight loss is also very complicated. There's surgical weight loss, medical weight loss, and as you know, certain things can get reversed by weight loss surgeries, and that cannot be reversed by. So we actually have an ongoing research study looking at UCSD, looking at effect of weight loss between medical versus surgical weight loss, try to clarify these things. But in general, by decreased percent body fat, you do make the testosterone work a little harder, a little longer for you. So that's not a benefit of weight loss.
Great. And so you alluded to this, but I mean, in some ways you could say, well, if it tapers off as you get older, why not just give everybody testosterone automatically? There are some consequences to taking hormone if it's not appropriate for you or if the levels get too high.
Exactly. Yeah. No, that's a great point. A lot of people see testosterone as a magic bullet to aging. And yes, it's true, it has a lot of positive benefits associated with restoring a man's balance. However, I'm sure just as we hear a lot of advertisements on anti-aging clinic, we also hear a lot of advertisement from the medical trial lawyers talking about testosterone causing stroke, causing blood clot problem, heart attacks, and that.
Yeah, so there was a report, I think, from the New England Journal of Medicine that there's 4-fold increase in strokes that can occur.
Yeah. So exactly. So that's why the way I look at it is that testosterone, just like any medication, has its side effects, so doctors need to be monitoring them for it. And that there are certain conditions that a man should not be receiving testosterone, such as men with breast cancer, men with untreated high-risk prostate cancer, men with specific heart failures.
We should point out that in prostate cancer, you actually go the other way.
Yeah, so
you try and lower testosterone.
Yeah, prostate cancer is very interesting because prostate cancer is one of the very first hormones. Even before breast cancer, we find an association between hormone and cancer. So by castrate a man with prostate cancer, their cancer can regress or sometimes go away completely. So that's one condition where we want to be very careful.
Another medical reason to be carefully monitored and watched if you're getting testosterone, because prostate cancer all men get worried about as you get older. And here's, you're taking the wrong thing for it.
Exactly, and I think that's one of the biggest message I hope to come across today is that getting testosterone is not totally a benign thing. Therefore, it should be given by a medical professional who knows the side effects and screen men for side effects and contraindications to the medication. And that's the most dangerous part about the anti-aging clinics is that they don't always monitor a man for some of these other conditions, and this could be very dangerous because one of the side effects of testosterone, it can make a man's blood too thick, or called polycythemia. We used to give men who are anemic on renal failure testosterone. So if your blood gets too thick and we don't know about it, of course men are getting strokes and heart attacks. So that's why.
Have there been many good controlled studies where you get the placebo, you get testosterone, we follow people for 5 years, and we show how they do lifestyle-wise and what their scores are in surveys and their health? There
are a few randomized control studies looking at men did this way. Unfortunately, they're all sponsored by pharmaceutical companies. So most of the results are obviously prove a positive benefit with very little downside, and that's why the drug got approved by the FDA. At UCSD, we're part of an NIH-sponsored study called Mr. T. And it's we don't need to have a catchy name for everything, right? And then it's actually a multi-institutional study sponsored by NIH, specifically following older men who we randomize them to testosterone versus no testosterone, and we're studying their side effects. Our study has closed in terms of its enrollment. We should hopefully have data around year 2020, and that will be the first non-industry sponsored randomized study, hopefully shed light a little bit on not just the positive benefit, but also the side effects of testosterone.
It's the story of why it's so important to be at a medical school and a university where academic work is being done, not just to be able to get medicine, but to study it, to make sure we're doing the right thing and where it's going forward, and why you want to be with someone who is an expert and involved in all of this. How is testosterone given?
So testosterone currently can be given three ways. One is in a topical form. So you've probably seen commercials of putting it in our shoulders and upper arm area.
And that's a gel?
That's a gel. It comes in a gel or like an ointment style. And then some are put in the underarm region. Some can be placed in the inner thigh. And it's a daily application. So that's one way. Second way is an intramuscular injection. And that needs to be done either weekly or bi-weekly. And the third way is a long-acting testosterone formulation, which is also can be done as an injection or a subcutaneous implant, similar to women's birth control. That's also a hormone implant.
If I put it on as a gel and my son gives me a big hug, do I have to worry?
That's a very good question. So the only downside of the gel is that we do worry about transferring it to another person. And most of the medication does dry within about a minute. So as long as you wear clothing, a barrier, is adult to adult transmission is almost not a problem. However, for a lot of my older patients who are also primary caretakers for their grandkids, if you hold a little baby over your shoulder, you're sitting by the pool in San Diego where there's nice weather, we do worry about transferring between a baby to an adult because you don't want to expose a newborn to exogenous testosterone because they're very sensitive to hormonal changes at that age. So therefore, we do caution men, make sure they take the proper precautions, especially when you're exposed to young children.
If testosterone is given to younger men who, I don't know, want to be better at football or want to be better athletes, and does it affect their fertility or affect them from a negative health standpoint?
Yes, and that's another take-home point I would take home was the testosterone on the young people. At one point, there was a study came out that 40% of high school athletes were exposed to some kind of testosterone steroids.
Wow.
Because at that level, we don't do as much strenuous testing of the athlete, not at college level or professional level. So unfortunately, the abuse of anabolic steroids is actually more common than we care to admit, and not just for cyclists and things like that. As part of my job, I do see male with infertility issues. A lot of the guys do come in haven't been exposed to testosterone. And it's kind of counterintuitive because as we think testosterone is important for sperm production, giving you more must be better, right? And that's what a lot of the men's health clinics, that's what they treat men, give them testosterone. Unfortunately, when a man is exposed to testosterone, our body get lazy. So we start making our own testosterone, which in turn start making our own sperm. So at one point, testosterone was actually studied as a male birth control. And then what I found was that giving a healthy college man testosterone, in 6 months, we pretty much sterilized them. So
I think it's really important for college students who might be thinking about this to hear that they can become sterile or infertile by taking this medicine.
Exactly. And then luckily for us, there are ways to turn their body back on. Because I describe to the guys is that your body is in off mode, because your body is used to being exposed to testosterone.
We have to turn it back on.
Exactly, we turn it back on. But unfortunately, even though 80% of the guys we can turn back on, they're usually not at 100% of what their fertility was. So it is a partial recovery, but at least it is not an irreversible damage. So that's the.
So if you are healthy and you're using, your body's making the right amount of testosterone, supplementing really doesn't make sense.
No, and there are other ways that I do see young men with hormone imbalance, and there are other ways to boost a man's endogenous or their own testosterone by using other medications. And clomiphene citrate is one of the medications that we commonly use, and how it works is that it tricks a man's brain to think that we haven't made enough testosterone. So the brain sends more signals down below the belt, so that way you push the testicle to work harder. So that's one way that we can boost a man's testosterone naturally.
So if we made the world according to Hsieh, what do you want to see happen in this field? Because obviously there's advertising and there's financial things going on, but obviously also there's a health issue that's happening as well, and we have to make sure this gets used properly. The world according to Hsieh, how would you like to see this go forward?
Yeah, I think we are already making a lot of positive changes. I think testosterone now is a controlled substance, so it can only be prescribed by certain medical professional. Previously, it wasn't. So that I think just like medication, that some can be over the counter, some need to be monitored. So we do need to limit the medications access, and then there's unfortunately the internet, the gym, the trainers. People can always get their medicine from other means. But in my ideal world, I think all men with symptoms suggestive of low testosterone should be screened by their primary care physician or a healthcare professional, and that if they are appropriate, they should receive a hormone supplementation. However, but these men need to understand this is a lifelong treatment, and that they need to be monitored lifelong as well. So we're very strict at our offices. If a man missed their appointment, they do not get a refill of their medicine because the medication has downsides. It's almost like chronic pain centers where they limit a number of narcotic pain medication they give to the chronic pain patients because it is a medication with a potential for abuse. Therefore, we need to monitor the patients, not just to control them, but also to protect them from some of the harms that can be associated.
And these days, internal medicine doctors are equipped to be able to do both the evaluation, diagnosis, and treatment and monitoring.
For most primary care physicians, they are aware of low testosterone, and they might not be able to offer all the treatment options that I outlined for you previously. However, they usually are very capable of working up a patient, start the initial evaluation, and if they're not comfortable, they're all professionals that they can refer patients to various resources.
But still the right place to start?
Yes.
Not everybody, you don't want to line out your door of every man.
No, I mean, and I think I want to dissuade them from, I think a lot of times men are embarrassed about seeing their doctor. They don't want this to be on their medical records. They worry about, insurance companies seeing that. So that's why they seek out some of the for-profit anti-aging clinic where it's more discreet and whereas, they can keep their identity a little bit more, off the books. But I want them to realize that this is actually a very common problem. You see, just like erectile dysfunction, you see ads during Super Bowl, doing nightly regular primetime TV for these conditions. Yes. So you shouldn't feel embarrassed about talking about these. This is it's a normal process of aging, first of all. So if a guy lived long enough, we all have this.
Happen.
Exactly. So you should feel comfortable talking to a healthcare professional about it, and then be referred to the appropriate resources.
Well, thank you so much for taking the time to chat with us today. This is a really important topic, and I'm looking forward to having you back on and talk about all the other list of things that you're doing through the Men's Health Clinic as well.
Sure.
Well, we really appreciate your time.
Great. Thanks for having me.
I've been talking to Dr. Mike Hsieh, and I hope you're listening again, because it's so tempting to go in and take medicine into your own hands and just think, I need this. And if you're young, thinking that testosterone supplementation is going to make you a better athlete or that it's going to make you more sexually voracious, think again, because it has all sorts of problems associated with it. This is not the time to take medicine into your own hands. You need to go to somebody who can actually follow you, monitor you, and think carefully about what you're doing. Aging does have some consequences, and we have some help for you. If you go to the right people, they can take care of you and help make sure you stay healthy. Remember, knowledge is power. I'm Dr. David Granet, and we'll see you here again next time on Health Matters.